everyone. Hi, Dr. Varon. This is Nina Corpus. I'm a health journalist and health advocate in the Philippines, and I host a health web series called hashtag Healthy Naman, and we're glad to talk to you tonight. My question is, what medications are not allowed to be taken with ivermectin? For example, medication for anti-TB, blood thinners, and the like, and also for common maintenance meds like for diabetes, hypertension, and cholesterol.
You can take any medication you want of the ones that you mentioned, anti-tuberculosis medications. There is no issue with any of those medications. People that take anti-tuberculosis medications on regular basis get blood work to make sure that their liver is not having any issue related to the TB medication. So on those patients, you also check the, the liver function on the basis of the conjunction of ivermectin and tuberculosis medication, but it doesn't give you any problem. Diabetes, blood pressure medications, cholesterol medications, no problem. As I said, the only one that we actually get a little concerned about is the use of a medication called cyclosporin, which is a medication that's used for transplant recipients. And the reason why we do that is because the levels of cyclosporin may go up or down depending on each patient. And you just want to make sure that that level doesn't fall below a number where they can get in trouble. But it's a very safe medication. As I said, think about it, 3.7 billion doses have been administered. It's one of those medications that have gotten the largest amount of sales for other things in the world.
Mm. Okay, Dr. Varon, I have a follow-up question. How about for people who have lupus and cancer?
No problem. I mean, it's we use it all the time for patients that have rheumatological disorders such as lupus, rheumatoid arthritis, Jorgen syndrome. I mean, all of those things, not a problem whatsoever. As far as the cancer patients, also there is no issue. We give them to them at all point in time without any issue.
And what is an overdose? How high would it need to be if there is such a thing?
I have never in my life seen an overdose of ivermectin. I would imagine that somebody would have to take like a whole 50 or 100 tablets. But my only concern under those conditions would be liver damage. Even though, as I said, there is really not one case that has been reported of true liver damage that can only be attributed to ivermectin, but that would be the only concern. So imagine a small child that finds the pills and eats them all, but they would have to be a lot because it's a very safe drug. Again, very safe drug. It used to be used in South America to cure river blindness, and they have not had a single case of river blindness in years since they started using ivermectin.
Okay, I have a last question. Going back to the question on how you take ivermectin when vaccinated, did you say you should take it 8 weeks after being vaccinated?
8 weeks after the first dose. So if
Okay.
you get your first dose today, then you have 4 more treatments of ivermectin if you're taking it from a preventive standpoint every 2 weeks. So you would take every 2 weeks your dose of ivermectin 4 times.
That's right after getting vaccinated. Can you tell us how long should we wait
I,
after, let's say, the
as I
first?
said, you are not going to develop full immunity with your vaccine for a total period of about 8 weeks, assuming that you get your vaccine in 2 doses. It usually takes about 8 weeks to get the full extent of the immunity that you're going to have in your system. So I want to make sure that people continue to take their ivermectin for those 8 weeks so that they are protected. And as I said before, some of my friends in the FLCC, they continue to take their ivermectin despite the fact that they were vaccinated months ago. And they do so because they are concerned that some of these variants may not be covered by currently available vaccines. And ivermectin appears to have some protection against some of those variants. So they keep on taking it. And because it's such a safe agent, then you don't need to to do anything special. Just keep on taking your medication. It's just once every 2 weeks. That's not that bad.
Okay, thank you, doctor.
My pleasure,
Thank,
man.
thank you, Nina. Doctor, there's a question here from PhD Doctor Andrew Luson. He's asking, transplant patient taking tacrolimus. In the president's conference, you and another doctor said people taking tacrolimus should not take ivermectin. Is this true? What are the dangers?
Again, people that are taking tacrolimus,
Okay, thank you.
it's another immunosuppressive agent that works through a same pathway as ivermectin. And again, in those patients, we have given ivermectin, but we check the levels of the tacrolimus, very similar to the cyclosporin that I was mentioning earlier. That's why people that have transplants, the decision of starting them on ivermectin needs to be done in conjunction of their, obviously, with their transplant team. Make sure that you don't mess up the transplant by giving ivermectin. But again, there are very few transplanted patients, so this is a minimal number of the total population. We are aiming to care for as many patients as we can and prevent as much deaths and disability as we can.
Thank you. Un poco de paciencia, Jimmy Fabregas. Okay. We have a long line. Just to warn the admin, Dr. Homer Lim is next, then Jimmy Fabregas, then Deputy Speaker Bernadette Herrera. Just very quickly, Dr. Baron, we actually did the math. It's if the lethal dose is 50 milligrams per kilogram of ivermectin, we're talking about over 200 pills at 15 milligrams per pill.
Mhm.
Dr. Homer Lim, can we get Dr. Homer Lim unmuted so he can ask his question finally? After him will be Jimmy Fabregas, and then Deputy Speaker Bernadette, and then Patty and Dulce. We'll just jump through those who've been raising their hands for a while. Dr. Homer, go ahead, please.
Good, good morning, Dr. Baron. Good morning, good evening, everyone. So, Dr. Baron, from the beginning of this COVID pandemic, have you seen a shift in the way it behaves? Meaning, from initial symptoms, do we see a sudden change in how the patient's symptoms evolve? Has it become faster or slower? Because a lot of people are now so afraid and freaking out because they say once you get COVID in 3 days, you're already dead. So I guess that's the question.
Well, that's a great question, and the answer is no. You don't die in 3 days with COVID. I know that everybody thinks about it, but no. The problem is, a lot of people don't come to the hospital on time. My average patient coming to my emergency department takes about 2.5 weeks before they come to us. And of course, by the time they go there with one foot on the grave. And if you remember that this is a phase-specific illness, remember I said there are three stages or three phases. On that first phase, the first 8 days, that's when the virus is multiplying. You are going to feel sick, you're going to have nausea, you're going to lose your sense of smell, taste, stuff like that. But you don't start having respiratory issues until the very end of that first phase. And it's during the second phase when you really start getting short-winded and things like that, you start developing some clots. And in the third phase, which is on the third week, that's when people die. That's when people get in trouble. So no, but the one thing we know is that time to treatment makes a difference. It's not the same for me to give you my Math Plus protocol on day 1 than to give you my Math Plus protocol on day 15. And that's one of the main reasons why a lot of the therapeutic interventions that we have had on COVID don't work. For example, remdesivir. Remdesivir will only work in the first few days of the illness because that's when the virus is active. But remdesivir does nothing for inflammation and clotting. The other one is convalescent plasma. Convalescent plasma doesn't even make sense, to be honest to you, because again, you have to have active virus to use it. By the time you come to the hospital, most people don't have the active virus. People don't want to go to the hospital for a variety of reasons. Number one, they are concerned that they're going to get COVID in the hospital, which is kind of dumb because they already have the COVID. Number two, they are concerned that they are going to die in the hospital. And number three, They're concerned about the financial implications of going to the hospital. Those are the reasons why people come to the hospital near death. And in my experience, they come in with one foot on the grave. I've had, yesterday night, I admitted a 21-year-old man that had symptoms for 3 weeks that almost died on me last night because he waited 3 weeks. And because, quote, he's young, he doesn't have any pre-existing conditions, so therefore nothing happens to him. Well, guess what? Now he's hooked up to a respirator and he's not doing too well.
All right. Thank you, Doctor. Jaime, all yours. Jimmy Fabregas.
Yes. Buenas noches, Doctor. I really just have one basic question. Porque in the Philippines, you know, we're in this situation where you don't know if you're getting the right meds for the right disease. So right now, my question is, there is an Ivermectin for pets, and there's an Ivermectin for humans. How are we sure that the Ivermectin that we are getting here is good for us? Because the people have been saying that, you know, you have to differentiate. ¿Cómo va?
Well, thank you for your question. It's a good question. You know, in the United States, we've had similar issues, especially when we start having a low number of pills available on ivermectin. People started to go and taking the medication that they would give to their horse or to their cat or to their dog. I mean, I was actually thinking one day about taking my dog's heartworm medication and see what happened. But the quality of, at least in the US, the quality of the veterinary use ivermectin is very, very good. I mean, I don't encourage people to go and take their dog's pills or their cat's pills or their horse pill, but the quality in the US is very good. So that really depends on the quality control that you have in the Philippines and where is actually the medication manufactured. But in the States, we've had people that take it. And actually, I have even several slides where, I don't know if you know, but ivermectin can also be, can have flavors for veterinary use because horses don't like to take it. So they have it with apples flavor, they have it with other kind of flavors. So people are actually taking it with flavors. And that's actually very common also in South America, where it became very difficult to find. So veterinary use, it's something that I don't encourage, but can be done.
So it is. You're saying that it can be safe. We can take the veterinary.
I think at least the one that we have in the States is safe. I'm not familiar as to which one you guys have there, but again, I wouldn't endorse it. But if I hear that somebody got it, I think that they don't have to worry. I mean, they are not going to start barking or doing anything like that.
Muchas gracias.
Un placer.